Module 3. Practical Challenges and Considerations in XR. Shaping the Health and Care Workforce of Tomorrow. Lesson 6. Patient Engagement and Safety in VR Applications. Welcome back. In this session, we'll explore two crucial aspects of using VR in healthcare: patient engagement and safety. These two elements go hand in hand because, while VR has the potential to captivate and empower patients, it must also be implemented in a way that ensures their safety and comfort. My name is Januario Sana, and today, I'll guide you through best practices, challenges, and real-world strategies for engaging patients while keeping safety at the forefront. Let's start with patient engagement, a cornerstone of effective healthcare. Engaged patients are more likely to adhere to treatment plans, experience better outcomes, and report higher satisfaction levels. However, achieving meaningful engagement can be challenging, especially for patients who are anxious, in pain, or facing lengthy treatments. This is where VR shines. Unlike traditional patient education tools like brochures or videos, VR provides immersive, interactive experiences that capture attention and foster a sense of involvement. Patients don't just learn about their condition or treatment, they experience it in a way that feels real, memorable, and empowering. For example, consider a cancer patient preparing for their first chemotherapy session. Instead of listening to a verbal explanation, they could use VR to virtually walk through the procedure in advance. This immersive preview can reduce fear and uncertainty, giving them a sense of control over their experience. Research supports these benefits. A study published in JMIR Mental Health, 2021, found that VR significantly improved patient understanding of complex medical procedures while reducing anxiety. Similarly, immersive VR experiences have been shown to enhance rehabilitation adherence by gamifying exercises and making them more enjoyable. But how VR improves patient engagement? VR enhances engagement in several ways. 1. Immersion. By immersing patients in a fully interactive environment, VR eliminates external distractions and focuses their attention. For example, a patient using VR during a wound care procedure may be so absorbed in a virtual beach scene that they forget about the discomfort. 2. Empathy and understanding. VR can simulate medical conditions or treatments to help patients better understand their own experiences. For instance, VR might show a diabetic patient what happens to their blood vessels during hyperglycemia, driving home the importance of lifestyle changes. 3. Personalization. VR content can be tailored to individual patient needs, preferences, and cultural contexts. This makes the experience not only engaging but also deeply relevant. For active participation, unlike passive learning tools, VR encourages patients to take an active role. For example, in a VR rehabilitation program, patients might collect points for completing exercises, transforming the task into a rewarding experience. While VR's ability to engage patients is impressive, safety must remain the top priority. This includes both physical safety, such as preventing motion sickness or discomfort, and psychological safety, such as avoiding distressing or overwhelming experiences. Now let's look at some key considerations for ensuring security in VR applications. Screening patients for suitability. Not all patients are ideal candidates for VR. Conditions like motion sickness, epilepsy, or severe anxiety may make VR uncomfortable or even harmful for certain individuals. The best solution is to develop a simple screening protocol to assess the suitability of each patient. Ask about conditions such as a history of migraines, sensitivity to movement, or fear of enclosed spaces. Calibrating VR systems. Improper calibration can lead to discomfort, such as eye strain or nausea, which are common issues in poorly optimized VR experiences. In these cases, it is necessary to ensure that the VR system is adjusted correctly for each patient, including the interpupillary distance, IPD, and the fit of the headset. Provide breaks during extended sessions to minimize fatigue. Psychological safety. VR's immersive nature is powerful, but it can also evoke strong emotional responses. A patient undergoing a virtual simulation of a stressful scenario might feel overwhelmed or distressed. With the study and practice of technology, VR content should be carefully selected or designed to match the patient's emotional state and resilience. For example, avoid overly intense simulations for patients with high levels of anxiety. Consider adding calming elements such as soothing sounds or guided breathing exercises. Infection control. In a clinical setting, infection control is critical, especially when multiple patients are using the same VR equipment. Headsets and controllers must be sanitized between uses to prevent the spread of pathogens. For these reasons, it is necessary to use disposable face coverings for headsets and establish strict cleaning protocols for all VR equipment. Supervision and support. Patients using VR should never feel abandoned or unsupported. They may require assistance with putting on the headset, navigating the experience, or understanding the purpose of the session. The solution is to assign trained staff to guide patients through their VR experience, monitor signs of distress, and provide reassurance as needed. Let's look at some real-world examples that highlight the balance of engagement and safety. 1. VR for pediatric anxiety. VR is used to distract pediatric patients during blood draws. Children wear a headset and enter a virtual world where they play games or interact with calming environments. Studies show this approach reduces pain perception and anxiety. 2. VR in chronic pain management. Institutions like Cedars-Sinai Medical Center have used VR to help chronic pain patients engage in mindfulness and relaxation techniques. These programs are carefully designed to minimize discomfort and provide gradual, positive reinforcement. 3. VR for preoperative education. Patients undergoing joint replacement surgery used VR to explore the operating room and learn about the procedure. To maximize VR's potential, it's essential to address common barriers. Accessibility. Not all patients may have access to VR due to financial or logistical constraints. Shared resources and mobile VR units can help expand access. Cultural sensitivity. VR content should reflect diverse cultural contexts to ensure all patients feel included and respected. Training for staff, nurses and clinicians must be well versed in using VR tools to confidently engage patients and respond to their needs. The future of VR in healthcare is bright. Advances in artificial intelligence, AI, will enable even more personalized experiences, adapting VR content to a patient's emotional and physiological responses in real time. For example, AI could monitor a patient's heart rate and adjust the VR environment to maintain a state of calm. Additionally, as VR hardware becomes more affordable and portable, its use will extend beyond hospitals to home care, community clinics, and telemedicine, making immersive patient engagement a global possibility. In summary, VR has the power to transform patient engagement, making healthcare experiences more interactive, empowering, and enjoyable. However, this potential must always be balanced with a commitment to patient safety. By thoughtfully designing and implementing VR programs, we can ensure that every patient benefits from the technology in a way that is engaging, safe, and effective. Thank you for joining me for this session. In our next lesson, we'll tackle the ethical and psychological aspects of VR in clinical care, a critical topic as we continue integrating immersive technologies into healthcare. See you then.